Color vision is a very important issue in everybody's life. Colors are there in the world, the life is colorful. If colors having a problem, then life is not so colorful. I am Dr. Goyal from Sanjeevan for Perfect Eyesight, Bombay. Today's topic is very important. If you are diagnosed as colorblind or partial retinal deficient or color deficient, then what to do? Is a very important issue because it's a career-oriented problem, daily routine-like problem. Otherwise, also it's a very important issue of color vision. First, the name colorblind is not the correct name according to me. The person is not blind, but color vision deficient or partial color vision deficiency, it should be the right name because person is not completely colorblind. First, we should understand how we see colors. The backmost part of the eye is called as retina. The layer which is behind backmost area of the eye is called as retina. They are photosensitive cells. They sense light, they sense colors. That layer is called as retina. There are two parts of the retina, peripheral and central. Central part is called as macula, 2 to 3 millimeter area. And the center of the macula is called as fovea centralis, that is 0.2 to 0.3 millimeter area. The area is having cones. Cone cells. Their cells are mimic cone in the structure. How we see in the cone? Cone-like structure. 6 to 7 millions of cones are there in that area. They sense colors. Their function is, the function of the macula is day vision, fine vision, color vision. The peripheral part of the retina is made up of rods, small rods. 120 to 130 million rods are there in periphery. Their function are night vision, moving in the darkness, coming down from the step, peripheral vision, any light comes on the eyes to sense that and take care of the eye of that, from that. So that is the function of peripheral retina. So now, as our topic is color vision today, so we concentrate on the central part of the retina. In macula, central part, 3 types of cone cells are there. Long wavelength, which perceive red color, medium wavelength, which perceive green color, short wavelength, which perceive blue color. So many places and so many books and so many on the internet, they have written that these cells are defective or less. The people who are suffering with color vision deficiency, I think the correct thing is the people who are suffering with color vision deficiency, they have structurally normal cone cells in their eyes, but functionally they are not normal. So structure-wise, the cells are there normal, long wavelength, medium wavelength, short wavelength, but their function-wise they are not normal. The proof of that is that if some red car passes near to the colorblind or color deficient person, he can easily identify the red car is going. It means he has long wavelength cones in his eyes. If he stands in front of a tree and says the green leaves are there, it means he has the medium wavelength cones also in his eyes. If somebody gives a blue shirt or t-shirt and he can sense this is a blue color, then it is short wavelength cones are also there. So it shows structurally cone cells are there, but their functions are in problem. When the shade comes together, they get confused. That's what happened in partial retinal deficiency. It's a genetic problem. 4 to 8% in the male people are suffering with color vision deficiency. 0.4 to 0.8% females are suffering with this problem. So it's a genetic problem. If there is no disease in the eyes and person is colorblind, means This is deficiency coming from the generation to generation in genes. If some problem, disease like they have neurodeficiencies also. Now we talk of the retinal deficiency, which is the main concern of today's topic. If we go and see this color vision, if dominantly green deficient, red green deficiency, dominantly green deficient called as glutan. Red green deficient, dominantly red deficient called as proton. So they are glutans and protons. And in both the categories, they are mild, medium and strong. What we have here in Sanjeevan for perfect eyesight bombay, I have said in another video the diagnosis of color vision deficiency. Here also I just summarize the tests which are available here in Sanjeevan for perfect eyesight bombay. Ishihara test, HRR test, transfer D15 test or Munchel test, Edith-Green lantern test, transfer lantern test, CT test, anomaloscope, and CAT test. Though we have a CT test also, here and 100 U test also, like we have 15 coins in transfer D15 Munchel test, we have 100 coin test also. If the person is very mildly defective, a labyrinthine test is there, which can be said that mild colors were there in the coins. CAT test is very ultimate test for the color vision deficiency. Generally, people who wants to go in flying, like want to become a pilots and all, that test is very important for them. World over, even experts called color assessment diagnosis test. So these are the tests which will tell us the person is proton or glutan, mild, medium or strong. There are so many professions which require color vision clearance very must. Like in aviation, any post in aviation requires color vision clearance. Shipping, either Navy or Merchant Navy, they require too much of color vision clearance. That is very important. Signals and everything is in colors. Even in the Merchant Navy or in the Navy, the person who is in the deck or in the engine, both the places color vision is very much required. Previously, engine they were a little softer for that, selecting the employees for the matter of color vision, but not now. The deck area also and the engine area, everything is required color vision clearance. Even in other professions, like in defense, in commandos, police, bank, even hospitality, medical. If the doctor is colorblind, he can't get admission in surgery. He can't become a surgeon. They can't do postmortem. When they want to become MBBS also, in the second and the first MBBS, they have a physiology, in second MBBS they have a pathology where they have to see the slides under microscope. In the slides, so many colors are there inside of the cells, tissues, etc. So very much important for engineering, very much important. Even the hospitality also very important. I remember the case, there was a waiter came for the color vision clearance because in every packet of food they have red sign and the green sign. Red sign is for non-veg people, veg is the sign for the vegetarian. If you serve non-veg packet to the vegetarian person, that will be a problem. In the banking, every note, every currency has their different colors. If any problem, that can be the problem. Even when you go for the driving test, it is very much required. They will not give you the driving license because signal color should be known to you. It should be seen to you. Maybe in the foggy condition, maybe in the rainy condition, in the daytime, night time, it should be very important. Otherwise, the chances of accidents are so much there. Web designing people, they work on the computer when the even single colors are very important. Color paint industries where the paint has different colors in there. Even the automobile industries. I think every department, every action of the life require color vision clearance. Even the day-to-day life, if you are going to match two colors for the clothing or anything, they require color vision clearance. So it's very important to be color vision clear. Now the important part is we know we are colorblind. Either glutan, mild, medium, strong, whatever it is. How to treat this problem? Because it's a genetic problem, X-linked chromosome problem. So cure may not be the possible because it's a genetic problem, but treatment can be possible. It means it may not go away from the genes, but if it can be treated, then whatever normal practical problems are coming in the life can be taken care of. Normal life, career, driving, these problems can be taken care of. Then it should be done in that way, which we do here in Sanjeevan for Perfect Eyesight. We rejuvenate the cold cells. There are two processes goes on in body: regeneration and rejuvenation. Regeneration means the cell divide 2 to 4, 4 to 8, 8 to 60, 60 to 32. Suppose anybody get hurt in upper limb or lower limb, hand and leg, without going to medical aid, the wound can get healed up, wound can get corrected because the cells divide, they regenerate. But here in cold cells, they never regenerate, they never divide. But we can rejuvenate them. After the rejuvenation, their function becomes like how a normal eye means the eye which is not having color vision deficiency, how their cold cells are functioning, your cold cell may function in the same way, then you may not face the problem whatever you are facing now. Because this problem is by birth. As I said, it's a genetic problem. But we come to know when we are looking for the careers mostly, or when you are looking for, or when you are going for studies, when you come to know. So that time you get bugged up what to do now. So the rejuvenation can be possible of these cells, what we do here in Sanjeevan for Perfect Eyesight Bombay. Here, there is no memorizing the book, no brain mapping, no cheating, no memorizing the book, no giving lances, no giving anything without cheating. We rejuvenate the cells from inside. As I said, structurally cold cells were normal before, but functionally they were not normal. If the rejuvenation can be done, the function also becomes normal. Then there is no problem. Then we should go again for the comprehensive test, what I mentioned before, and check. When every test is coming within normal limit, then you are open to go. The sky is in front of you, you can fly. I mean to say, you can go to any department wherever you wish to go. There is no need to take tension. They need to take tension. We have very good treatment here in Sanjeevan for Perfect Eyesight Bombay, where there is no operation, no laser, no LASIK, no steroids, no antibiotic, no side effect, no memorizing the book, no brain mapping, no cheating, no lens giving. We have to rejuvenate your bone cells so they can function normally as they are functioning in the person who is not colorblind. And how to maintain that also we advise here so they can maintain the good color vision and the vision throughout their life. So it was a very important issue today we have talked about. And if you have any question and query regarding color vision treatment, color vision diagnosis, you can contact us on the details described. Thank you. See you in the next video.
Jeevan Eye Care for perfect eyesight.